The thing that I'm doing now with my practice is I'm going to be doing ICL surgery in an in-office operating suite. So, and I'm really excited about it because we find that there's several barriers to doing ICLs, and we're trying to strike down as many barriers as we can. Because the fact is that the ICL is the best refractive surgery procedure for many patients. And every time I do an ICL, it's kind of like that perfect golf shot where this is why I keep coming back and I want to do more. So I'm trying to take down as many barriers as I can. And one of the barriers to ICL is where it's done. So when we take patients to the hospital or to the ASC, in the patient's mind, they start to view the procedure more like a major surgical event and less like a procedure like LASIK is. There's also major cost implications of doing it in an ambulatory surgery center versus keeping it in-house. And so what we've done is created an in-office operating suite where we can safely and comfortably perform intraocular surgery in the same space where we perform the LASIK procedure. So that helps us, introduce, when we give a patient a tour of our facility, we're able to say, this is the procedure room. When patients have vision correction, whether it be PRK, LASIK, or Visian ICL, it's all done in here. And so patients don't hear things like, oh, I need to have anesthesia, and equate that with more pain. We're also able to keep our costs down so that there's not a big barrier of price point between LASIK and ICL. So, and the main thing that we're concerned about when we consider doing ICL surgery in an in-office operating suite is that, it needs to basically be an operating suite that's sterile enough and proper enough to be doing intraocular surgery. So for example, we are not doing intraocular surgery in our garage or in our basement. We're doing ICL surgery in an in-office surgical suite that's specifically designed for intraocular procedures. And as such, we've gone out to get AAA HC certification on our facility, which basically says that we have the proper standards in our OR, we have the credentialing, we have nursing, we have cleaning and sterility devices that we need, and everything on backup that basically from a third-party certification committee says, we stamp this that says this is a sterile procedure room, unlike, very much like a hospital or an ASC. So in that regard, we feel we're able to protect our patients from risk like an infectious complication, but also able to protect ourselves from liability. So yeah, most important thing I would say right now in 2013 is consider doing ICL surgery in the in-office operating suite.